Question 1. A client with a new prescription for lithium carbonate reports experiencing nausea, vomiting, and fine hand tremors. Which actions should the nurse take? Select all that apply. A. Administer the prescribed PRN antiemetic. B. Notify the healthcare provider immediately. C. Document the client's symptoms and continue monitoring. D. Withhold the next dose of lithium. E. Encourage the client to increase fluid intake. F. Obtain a SATA serum lithium level. Answer. Notify the healthcare provider immediately, withhold the next dose of lithium, obtain a SATA serum lithium level. This question tests the nurse's ability to recognize signs of lithium toxicity and implement appropriate interventions. The keywords nausea, vomiting, and fine hand tremors are classic early indicators of lithium toxicity, which requires immediate attention. The nurse must prioritize client safety by withholding the medication, notifying the provider, and obtaining a SATA lithium level to confirm the diagnosis and guide further treatment, as increasing fluid intake might worsen toxicity if renal function is impaired. For example, if a client shows these symptoms, stopping the medication and checking the blood level promptly can prevent more severe neurological complications. Here's an easy way to remember: symptoms of toxicity always mean stop, notify, and check the level for potent medications. Question 2. The nurse is caring for a client with a history of heart failure who presents to the emergency department with dyspnea and bilateral pitting edema. Which nursing interventions are appropriate for this client? Select all that apply. A. Administer oxygen as prescribed. B. Elevate the head of the bed. C. Restrict fluid intake. D. Encourage ambulation to promote circulation. E. Administer a prescribed diuretic. F. Place the client in a Trendelenburg position. Answer. Administer oxygen as prescribed, elevate the head of the bed, restrict fluid intake, administer a prescribed diuretic. This question assesses the nurse's understanding of immediate interventions for acute exacerbation of heart failure, indicated by dyspnea and bilateral pitting edema. These symptoms point to fluid overload, a hallmark of heart failure, which necessitates measures to reduce cardiac workload and fluid retention. Providing oxygen, elevating the head of the bed, restricting fluids, and administering a diuretic all work to improve oxygenation and decrease circulating volume, while ambulation and Trendelenburg position would worsen symptoms or be contraindicated. For instance, a client struggling to breathe will benefit greatly from sitting upright and receiving oxygen, as this improves lung expansion and oxygen delivery. Here's an easy way to remember: think O2, upright, and fluid out to manage fluid overload in heart failure. Question 3. A client is admitted with diabetic ketoacidosis, DK. Which findings should the nurse expect to observe during the initial assessment? Select all that apply. A. Bradycardia. B. Kussmaul respirations. C. Fruity breath odor. D. Hypoglycemia. E. Metabolic alkalosis. F. Polydipsia. Answer. Kussmaul respirations, fruity breath odor, polydipsia. This question focuses on the classic signs and symptoms of diabetic ketoacidosis, DK, a severe complication of diabetes. The key term diabetic ketoacidosis indicates a state of severe hyperglycemia, acidosis, and ketosis. Therefore, the nurse should expect to find Kussmaul respirations, deep, rapid breathing to compensate for acidosis, a fruity breath odor, due to ketones, and polydipsia, excessive thirst from hyperglycemia-induced dehydration, while bradycardia, hypoglycemia, and metabolic alkalosis are not characteristic of DKA. A practical example is a client presenting with rapid breathing and a distinctive sweet smell on their breath. Here's an easy way to remember. DKA causes fruity, fast, and thirsty symptoms. Question 4. The nurse is preparing to administer medications through a nasogastric (NG) tube. Which actions are essential for safe medication administration? Select all that apply. A. Crush all medications into a fine powder. B. Verify tube placement before administration. C. Flush the tube with 15 to 30 milliliters of water before and after medication administration. D. Mix all medications together in one syringe. E. Administer medications at room temperature. F. Maintain the client in a supine position during administration. Answer. Verify tube placement before administration. Flush the tube with 15 to 30 milliliters of water before and after medication administration. Administer medications at room temperature. This question evaluates the nurse's knowledge of safe practices for administering medications via a nasogastric (NG) tube. Ensuring proper tube placement is critical to prevent aspiration, and flushing the tube prevents clogging and ensures full dose delivery. Administering medications at room temperature reduces the risk of abdominal cramping, whereas crushing all medications is incorrect as some are extended-release or enteric-coated. Mixing all medications can lead to interactions or clogging, and the supine position increases aspiration risk. For example, before giving medicine, the nurse should always check the NG tube's position and then rinse it well before and after. Here's an easy way to remember. Think placement, flush, and warmth for NG tube med safety. Question 5. A nurse is caring for a client with Clostridium difficile infection. Which interventions should the nurse prioritize to prevent the spread of infection? Select all that apply. A. Wear an N95 respirator mask when entering the room. B. Perform hand hygiene with alcohol-based hand rub. C. Use soap and water for hand hygiene. D. Don a gown and gloves before client contact. E. Place the client in a negative pressure room. F. Dedicate equipment for single client use. Answer. Use soap and water for hand hygiene, don a gown and gloves before client contact, dedicate equipment for single client use. This question assesses knowledge of specific infection control precautions for Clostridium difficile, C. difficile, a spore-forming bacterium. C. Diff spores are not killed by alcohol-based hand rubs, making soap and water essential for hand hygiene. Contact precautions, including gown and gloves, and dedicated equipment are necessary to prevent environmental contamination and transmission. An N95 mask and negative pressure room are for airborne precautions, not C. diff. For example, after caring for a client with C. diff, the nurse must physically wash their hands with soap and water, not just use hand sanitizer, because the spores are resistant. Here's an easy way to remember. C. diff requires soap and water, gown and gloves, and dedicated gear. Question 6. The nurse is assessing a client presenting with symptoms of a ruptured ectopic pregnancy. Which findings should the nurse anticipate? Select all that apply. A. Sudden, severe, unilateral lower abdominal pain. B. Vaginal bleeding that is heavy and bright red. C. Referred shoulder pain. D. Bradycardia and hypertension. E. Signs of hypovolemic shock. F. Uterine enlargement consistent with gestational age. Answer. Sudden, severe, unilateral lower abdominal pain, referred shoulder pain, signs of hypovolemic shock. This question tests the nurse's ability to recognize classic signs of a ruptured ectopic pregnancy, a life-threatening obstetric emergency. A ruptured ectopic pregnancy involves bleeding into the abdominal cavity, leading to sudden, severe, unilateral lower abdominal pain and referred shoulder pain, due to diaphragmatic irritation from blood E. The significant internal bleeding causes signs of hypovolemic shock, such as pallor, tachycardia, and hypotension, rather than bradycardia and hypertension. Vaginal bleeding is typically scant and dark, not heavy and bright red, and the uterus would not be significantly enlarged. For instance, a woman collapsing with acute abdominal pain and pallor needs immediate evaluation for this condition. Here's an easy way to remember: think pain, shoulder, shock for ruptured ectopic pregnancy. Question 7. A client with chronic kidney disease, CKD, is receiving hemodialysis. Which assessment findings indicate a complication of hemodialysis that requires immediate intervention? Select all that apply. A. Blood pressure drop from 140/90 to 110/60 mmHg. B. Mild headache and dizziness during the procedure. C. Absence of a thrill and bruit over the arteriovenous, AV, fistula. D. Client reports muscle cramps in the legs. E. Temperature elevation to 100, 8 degree F, 38, 2 degree C. Ef. Pink-tinged urine after the procedure. Answer. Blood pressure drop from 140/90 to 110/60 mmHg, absence of a thrill and bruit over the arteriovenous, AV, fistula, temperature elevation to 100, 8 degree F, 38, 2 degree C. This question focuses on recognizing serious complications during or after hemodialysis. A significant blood pressure drop indicates hypovolemia or fluid shifts, requiring immediate intervention. The absence of a thrill and bruit over the AV fistula suggests occlusion or thrombosis, compromising dialysis access. A temperature elevation post-dialysis can signal infection or a reaction, demanding prompt assessment. Mild headache and dizziness are common but typically managed without immediate cessation. Muscle cramps are also common and treated with repositioning or saline, and pink-tinged urine is unrelated to dialysis. For example, if the access site stops working, the client cannot receive life-sustaining treatment. Here's an easy way to remember: prioritize pressure drop, access loss, and fever as urgent dialysis alarms. Question 8. The nurse is providing discharge teaching to a client with a new colostomy. Which statements indicate that the client understands the teaching? Select all that apply. A. I will empty my pouch when it is about 1/3 to 1/2 full. B. I should avoid eating gas-forming foods like cabbage and beans. C. I will change my pouch system daily to prevent skin irritation. D. I can participate in most of my usual activities, including swimming. E. I should notify my doctor if I notice any changes in the color or amount of my stoma output. F. I will use petroleum jelly around the stoma to protect my skin. Answer. I will empty my pouch when it is about 1/3 to 1/2 full. I can participate in most of my usual activities, including swimming. I should notify my doctor if I notice any changes in the color or amount of my stoma output. This question assesses proper self-care and adaptation after colostomy surgery. Emptying the pouch when 1/3 to 1/2 full prevents leakage and keeps it from becoming too heavy. Clients with a colostomy can typically resume most normal activities, including swimming, with a well-fitting pouch. Notifying the doctor about changes in output indicates appropriate monitoring for complications. Avoiding all gas-forming foods is unnecessarily restrictive, changing the pouch system daily is too frequent and can cause skin breakdown, and petroleum jelly can interfere with pouch adhesion. For instance, a client should feel empowered to live a full life, knowing how to manage their stoma effectively. Here's an easy way to remember. Empty when full, live normally, and report changes for colostomy care. Question 9. A client is prescribed digoxin. Which assessment findings would prompt the nurse to withhold the medication and notify the healthcare provider? Select all that apply. A. Apical pulse of 62 beats/minute. B. Serum potassium level of 3.0 milliequivalent/L. C. Client reports blurred vision and seeing yellow halos. D. Blood pressure of 100/60 mmHg. E. Client's weight gain of 1 kg in 24 hours. F. Presence of S3 heart sound. Answer. Serum potassium level of 3.0 milliequivalent/L. Client reports blurred vision and seeing yellow halos. This question tests recognition of adverse effects and contraindications for digoxin administration. A serum potassium level of 3.0 milliequivalent/L indicates hypokalemia, which significantly increases the risk of digoxin toxicity, and blurred vision and seeing yellow halos are classic signs of digoxin toxicity. An apical pulse of 62 bpm is usually acceptable, as digoxin is held for rates below 60 bpm in adults. Blood pressure of 100/60 mmHg, a 1 kg weight gain, and an S3 heart sound, which indicates fluid overload, a reason for digoxin, not against it, are not direct reasons to withhold digoxin, although weight gain indicates worsening heart failure. For example, if a client on digoxin mentions unusual visual disturbances, it's a red flag for toxicity. Here's an easy way to remember. Low potassium and visual changes are key reasons to hold digoxin. Question 10. The nurse is caring for a client in skeletal traction. Which nursing interventions are appropriate for the plan of care? Select all that apply. A. Remove weights briefly to allow for repositioning and linen changes. B. Assess pin sites for signs of infection every 8 hours. C. Ensure ropes and weights hang freely. D. Provide pin site care as prescribed, typically daily. E. Encourage deep breathing and coughing exercises. F. Assist the client with active range of motion of the affected extremity. Answer. Assess pin sites for signs of infection every 8 hours, ensure ropes and weights hang freely, provide pin site care as prescribed, typically daily, encourage deep breathing and coughing exercises. This question evaluates the nurse's understanding of essential care for a client in skeletal traction. It is crucial to assess pin sites for infection regularly, ensure ropes and weights hang freely to maintain continuous traction, and provide pin site care to prevent infection. Encouraging deep breathing and coughing exercises helps prevent respiratory complications like atelectasis and pneumonia. Weights should never be removed as this interrupts traction. An active range of motion of the affected extremity is contraindicated to maintain alignment. For example, if the weights are resting on the floor, the traction is ineffective, and the nurse must immediately correct this. Here's an easy way to remember. Pins, weights, breath, and no movement are key for skeletal traction care. Question 11. A client with newly diagnosed type 2 diabetes is receiving education from the nurse. Which statements indicate effective understanding of the teaching? Select all that apply. A. I should check my blood sugar at least once a day. B. I will need to take insulin injections for the rest of my life. C. Exercising regularly can help improve my blood sugar control. D. I will try to eat consistent amounts of carbohydrates at each meal. E. I should call my doctor if my blood sugar is consistently above 200 milligrams per deciliter. F. I need to inspect my feet daily for any cuts or sores. Answer. Exercising regularly can help improve my blood sugar control. I will try to eat consistent amounts of carbohydrates at each meal. I should call my doctor if my blood sugar is consistently above 200 milligrams per deciliter. I need to inspect my feet daily for any cuts or sores. This question assesses the client's understanding of managing type 2 diabetes. Regular exercise and consistent carbohydrate intake are fundamental to blood glucose control. Calling the doctor for persistently high blood sugar shows appropriate self-management, and daily foot inspection is crucial for preventing diabetic foot complications. While daily blood sugar checks are good, at least once a day might be insufficient for some, and not all type 2 diabetics require insulin for life. For example, a client who understands that walking every day and eating balanced meals are key steps toward managing their diabetes shows good comprehension. Here's an easy way to remember. Exercise, consistent carbs, foot care, and knowing when to call are cornerstones of diabetes self-management. Question 12. The nurse is caring for a client with a traumatic brain injury who has developed syndrome of inappropriate antidiuretic hormone, SAID. Which findings should the nurse expect? Select all that apply. A. Polyuria. B. Hyponatremia. C. Increased urine-specific gravity. D. Elevated hematocrit. E. Decreased serum osmolality. F. Dehydration. Answer. Hyponatremia, increased urine-specific gravity, decreased serum osmolality. This question tests the nurse's understanding of the characteristic findings in syndrome of inappropriate antidiuretic hormone, SAID. SAID involves excessive secretion of antidiuretic hormone, ADH, leading to water retention and dilutional hyponatremia. Therefore, the nurse should expect hyponatremia, increased urine-specific gravity, concentrated urine, and decreased serum osmolality, diluted blood E. Polyuria and dehydration are characteristic of diabetes insipidus. The opposite condition, an elevated hematocrit, would indicate hemoconcentration, which is not typically seen in SIADH. For example, a client with SIAD might appear fluid overloaded but actually have dangerously low sodium levels in their blood. Here's an easy way to remember. SIAD means too much water, leading to low sodium and concentrated P. Question 13. A client is receiving total parenteral nutrition, TPN. Which nursing interventions are essential for safely managing TPN? Select all that apply. A. Administer TPN through a peripheral 4 line. B. Monitor blood glucose levels every 4 to 6 hours. C. Change the TPN bag and tubing every 48 hours. D. Use an infusion pump to regulate the flow rate. E. Weigh the client daily. F. Monitor for signs of infection at the catheter site. Answer. Monitor blood glucose levels every 4 to 6 hours. Use an infusion pump to regulate the flow rate. Weigh the client daily. Monitor for signs of infection at the catheter site. This question assesses critical nursing responsibilities for managing total parenteral nutrition, TPN, a hypertonic solution. Because TPN is high in glucose, monitoring blood glucose levels every 4 to 6 hours is essential to detect hyperglycemia. An infusion pump is mandatory to ensure accurate and consistent delivery, and daily weights track fluid balance and nutritional status. Monitoring for infection at the catheter site is crucial due to the high risk with central venous access. TPN is always administered via a central 4-line due to its hypertonicity, and the TPN bag and tubing should be changed every 24 hours to prevent bacterial growth, not 48 hours. For example, a client receiving TPN needs careful blood sugar checks to prevent complications. Here's an easy way to remember. TPN means pump, glucose, weight, and infection watch. Question 14. The nurse is preparing to discharge a client who had a total hip arthroplasty. Which instructions should the nurse include in the discharge teaching? Select all that apply. A. You may cross your legs at the ankles while sitting. B. Avoid bending at the waist more than 90 degrees. C. Use a raised toilet seat. D. You can sleep on your affected side with a pillow between your knees. E. Avoid internal rotation of the hip. F. It's safe to use a shower chair for bathing. Answer. Avoid bending at the waist more than 90 degrees. Use a raised toilet seat. Avoid internal rotation of the hip. It's safe to use a shower chair for bathing. This question focuses on crucial postoperative teaching to prevent dislocation after a total hip arthroplasty. To prevent dislocation, clients must avoid bending at the waist more than 90 degrees, use a raised toilet seat to maintain hip flexion within safe limits, and avoid internal rotation of the hip. Using a shower chair promotes safety and reduces the risk of falls. Crossing legs at the ankles or knees is contraindicated, and sleeping on the affected side or without a pillow between the knees can also lead to dislocation. For instance, a client should be taught to always keep their knees apart and hip extended to prevent the new hip from popping out. Here's an easy way to remember. Think no extreme bending, no crossing, no inward rotation to protect a new hip. Question 15. The nurse is assessing a client with a suspected ruptured appendix. Which clinical manifestations should the nurse anticipate? Select all that apply. A. Rebound tenderness at McBurney's point. B. Generalized abdominal rigidity. C. Increased appetite. D. Low-grade fever. E. Sudden relief of pain followed by worsening symptoms. F. Diarrhea. Answer. Rebound tenderness at McBurney's point, generalized abdominal rigidity, sudden relief of pain followed by worsening symptoms, low-grade fever. This question tests the nurse's ability to identify key signs of a ruptured appendix, a serious medical emergency. Rebound tenderness at McBurney's point is a classic sign of appendicitis. If the appendix ruptures, the pain may initially subside due to pressure relief but then worsen as peritonitis develops, leading to generalized abdominal rigidity and sudden relief of pain followed by worsening symptoms. A low-grade fever is common. An increased appetite and diarrhea are not typical, with clients often experiencing anorexia and constipation. For example, a client who reports their severe right lower quadrant pain suddenly got better, only to return worse with a stiff abdomen, needs immediate surgical evaluation. Here's an easy way to remember. Tenderness, rigidity, deceptive relief, and fever point to a ruptured appendix. Question 16. A client is receiving heparin infusion for deep vein thrombosis, DVT. Which laboratory values are most important for the nurse to monitor? Select all that apply. A. Prothrombin time, PT. B. International Normalized Ratio, INR. C. Activated partial thromboplastin time, APTT. D. Platelet count. E. Hemoglobin and hematocrit. F. Liver function tests, LFTs. Answer. Activated partial thromboplastin time, APTT, platelet count, hemoglobin and hematocrit. This question assesses the nurse's understanding of crucial laboratory monitoring for a client on heparin therapy. The APTT is the primary laboratory test used to monitor the therapeutic effect of unfractionated heparin. Platelet count is vital to monitor for heparin-induced thrombocytopenia, HIT, a severe complication. Hemoglobin and hematocrit levels are important to monitor for signs of bleeding, a common adverse effect of anticoagulant therapy. PT and INR are used for warfarin monitoring, not heparin, and liver function tests are not directly impacted by heparin in the same critical way as bleeding or platelet function. For example, if a client's APTT is too high, the heparin dose might need to be decreased to prevent excessive bleeding. Here's an easy way to remember. APTT, platelets, and HNH are your key labs for heparin safety. Question 17. The nurse is educating a client about the proper use of a metered dose inhaler, MDI, with a spacer. Which instructions should the nurse provide? Select all that apply. A. Shake the inhaler well before each use. B. Breathe in slowly and deeply through your mouth while pressing down on the canister. C. Hold your breath for 5 to 10 seconds after inhaling. D. Exhale forcefully before inhaling the medication. E. Clean your spacer weekly with warm water and mild soap. F. Administer 2 puffs rapidly one after another without pausing. Answer. Shake the inhaler well before each use. Breathe in slowly and deeply through your mouth while pressing down on the canister. Hold your breath for 5 to 10 seconds after inhaling. Clean your spacer weekly with warm water and mild soap. This question evaluates the nurse's ability to teach correct metered dose inhaler, MDI, technique with a spacer. Shaking the inhaler ensures the medication is evenly mixed. Breathing in slowly and deeply optimizes medication delivery to the lungs. Holding the breath for 5 to 10 seconds allows for better medication absorption. Regular cleaning of the spacer prevents bacterial growth and blockages. Exhaling forcefully before inhaling is correct, but the statement says after which is incorrect, and puffs should be separated by 30 to 60 seconds for optimal delivery if more than one is needed. For instance, instructing a client to inhale as if sipping through a straw helps them inhale slowly and deeply. Here's an easy way to remember. Shake, slow breath, hold, and clean are essential for effective MDI use. Question 18. A client with Addison's disease is admitted with severe fatigue and hypotension. Which nursing actions are priorities? Select all that apply. A. Administer intravenous fluids as prescribed. B. Provide a high-sodium, low-potassium diet. C. Monitor vital signs frequently. D. Administer prescribed corticosteroids. E. Encourage strenuous activity to improve energy. F. Prepare for ECG monitoring. Answer. Administer intravenous fluids as prescribed, monitor vital signs frequently, administer prescribed corticosteroids, prepare for ECG monitoring. This question tests the nurse's understanding of priority interventions for an acute adrenal crisis, a life-threatening complication of Addison's disease characterized by severe fatigue and hypotension. Administering intravenous fluids and monitoring vital signs frequently addresses hypovolemia and shock. Administering prescribed corticosteroids is critical to replace deficient hormones. Preparing for ECG monitoring is important due to the risk of hyperkalemia and cardiac dysrhythmias. A high-sodium diet may be beneficial but is not an immediate priority in a crisis, and strenuous activity would worsen fatigue and stress. For example, a client in adrenal crisis needs rapid fluid and hormone replacement to stabilize their blood pressure. Here's an easy way to remember. For Addisonian crisis, think fluid, vitals, steroids, and heart watch. Question 19. The nurse is assessing a newborn at 1 hour of age. Which findings are considered normal and expected? Select all that apply. A. Acrocyanosis. B. Respiratory rate of 28 breaths/minute. C. Jaundice noted on the face. D. Heart rate of 140 beats/minute. E. Positive Babinski reflex. F. Generalized petechiae. Answer. Acrocyanosis, heart rate of 140 beats/minute, positive Babinski reflex. This question assesses knowledge of normal newborn assessment findings. Acrocyanosis, bluish discoloration of hands and feet, is common in the first 24 hours. A heart rate of 140 bpm is within the normal range, 110–160 bpm. A positive Babinski reflex, toes fan out when the sole of the foot is stroked D, is a normal neurological finding in newborns. A respiratory rate of 28 bpm is too low, normal is 30 to 60 bpm, jaundice on the face at 1 hour is abnormal and needs further investigation, and generalized petechiae, small red spots from bleeding under the skin, could indicate a clotting disorder or infection and are not normal. For example, seeing a newborn's hands and feet appear slightly blue is a normal observation, but facial jaundice at this early stage is concerning. Here's an easy way to remember. Blue hands/feet, fast heart, and fanning toes are normal newborn findings. Question 20. A client is prescribed phenelzyme, Nardil, a monoamine oxidase inhibitor, MAOI. Which foods should the nurse instruct the client to avoid? Select all that apply. A. Fresh fruit salad. B. Aged cheese. C. Pepperoni pizza. D. Yogurt. E. Red wine. F. Cottage cheese. Answer. Aged cheese, pepperoni pizza, red wine. This question tests the nurse's knowledge of dietary restrictions for clients taking MAOIs, specifically concerning tyramine-rich foods. Aged cheese, pepperoni pizza, containing fermented meats, and red wine are all high in tyramine. Consuming these foods while on an MAOI can lead to a hypertensive crisis, a life-threatening condition. Fresh fruit salad, yogurt, and cottage cheese are generally low in tyramine and safe to consume. For instance, a client who unknowingly eats a slice of pepperoni pizza could experience a severe headache and dangerously high blood pressure. Here's an easy way to remember. MAOIs mean no aged, pickled, fermented, or cured foods to prevent a hypertensive crisis. Question 21. The nurse is caring for a client with a full-thickness burn injury. Which assessment findings indicate adequate fluid resuscitation? Select all that apply. A. Urine output of 20 milliliters per hour. B. Capillary refill less than 3 seconds. C. Heart rate of 110 beats/minute. D. Clear lung sounds. E. Blood pressure of 90/50 mmHg. F. Alert and oriented mental status. Answer. Capillary refill less than 3 seconds, clear lung sounds, alert and oriented mental status. This question assesses the nurse's ability to evaluate the effectiveness of fluid resuscitation in a burn client. Capillary refill less than 3 seconds indicates good peripheral perfusion. Clear lung sounds suggest no fluid overload in the lungs. An alert and oriented mental status signifies adequate cerebral perfusion. A urine output of 20 milliliters per hour is insufficient, should be 30 to 50 ml/hr for adults, A heart rate of 110 bpm is still elevated, target is usually less than 100 bpm, and a blood pressure of 90/50 millimeter of mercury indicates persistent hypovolemia or shock. For example, a client who is conscious, responsive, and has pink nail beds is showing positive signs of effective fluid replacement. Here's an easy way to remember. Clear mind, quick refill, and clear lungs suggest good burn fluid resuscitation. Question 22. A client is experiencing an acute asthma exacerbation. Which clinical manifestations should the nurse expect? Select all that apply. A. Bradypnea. B. Inspiratory and expiratory wheezing. C. Use of accessory muscles for breathing. D. Bradycardia. E. Cyanosis. F. Hyperresonance on percussion. Answer. Inspiratory and expiratory wheezing, use of accessory muscles for breathing, cyanosis, hyperresonance on percussion. This question tests the nurse's recognition of the classic signs of an acute asthma exacerbation. Asthma exacerbations cause bronchospasm and airway inflammation, leading to inspiratory and expiratory wheezing, use of accessory muscles due to increased work of breathing, and potentially cyanosis in severe cases indicating hypoxemia. Hyperresonance on percussion occurs due to air trapping. Bradypnea and bradycardia are ominous late signs, indicating severe respiratory fatigue and impending respiratory arrest, not typical early signs. For instance, a client gasping for air, hunched over, with a high-pitched whistling sound in their lungs, clearly demonstrates an asthma attack. Here's an easy way to remember. Wheeze, struggle, blue, and booming chest indicate an acute asthma attack. Question 23. The nurse is providing education to a client prescribed warfarin. Which statements should the nurse include in the teaching? Select all that apply. A. You can take aspirin for headaches while on this medication. B. Report any unusual bleeding or bruising to your healthcare provider. C. It is important to keep your vitamin K intake consistent. D. You will need regular blood tests to monitor the medication's effect. E. You should avoid all green leafy vegetables. F. Alcohol consumption does not affect this medication. Answer. Report any unusual bleeding or bruising to your healthcare provider. It is important to keep your vitamin K intake consistent. You will need regular blood tests to monitor the medication's effect. This question assesses crucial teaching points for a client taking warfarin, an anticoagulant. Reporting unusual bleeding or bruising is vital because it indicates potential over-anticoagulation. Consistent vitamin K intake is important as vitamin K can interfere with warfarin's action. Regular blood tests, INR, are essential to monitor the therapeutic effect and adjust the dose. Aspirin increases bleeding risk and should be avoided. Avoiding all green leafy vegetables is unnecessarily restrictive as consistency is key, and alcohol can significantly interact with warfarin. For example, a client should understand that if they notice excessive bruising or nosebleeds, they must contact their doctor right away. Here's an easy way to remember. Bleeding signs, consistent vitamin K, and regular labs are non-negotiables for warfarin safety. Question 24. A client is diagnosed with a urinary tract infection, UTI. Which symptoms should the nurse expect the client to report? Select all that apply. A. Urinary frequency. B. Hematuria. C. Flank pain. D. Fever and chills. E. Dysuria. F. Polyuria. Answer. Urinary frequency, hematuria, flank pain, fever and chills, dysuria? This question tests the nurse's knowledge of common symptoms associated with a urinary tract infection, UTI. Urinary frequency, hematuria, blood in urine, flank pain, if the infection has ascended to the kidneys, fever and chills, especially with pyelonephritis, and dysuria, painful urination, are all characteristic of UTIs. Polyuria, excessive urination, is not a typical symptom of a UTI. Instead, clients experience an urgent need to urinate frequently, but often only small amounts are passed. For example, a client complaining of painful, frequent urges to urinate and a dull ache in their back likely has a UTI. Here's an easy way to remember. Think FHHFD frequency, hematuria, flank pain, fever, dysuria for UTI symptoms. Question 25. The nurse is conducting a prenatal education class. Which signs are considered presumptive signs of pregnancy? Select all that apply. A. Amenorrhea. B. Ballottement. C. Nausea and vomiting. D. Fetal heart tones. E. Breast tenderness. F. Goodell's sign. Answer. Amenorrhea, nausea and vomiting, breast tenderness. This question assesses understanding of presumptive signs of pregnancy, which are subjective changes experienced by the woman that suggest pregnancy but are not diagnostic. Amenorrhea, absence of menstruation, nausea and vomiting, and breast tenderness are all common early subjective indicators reported by the client. Ballottement, rebound of the fetus in the amniotic fluid, and Goodell's sign, softening of the cervix, are probable signs, which are objective but still not diagnostic. Fetal heart tones are a positive sign of pregnancy, meaning they are definitive evidence. For example, a woman might realize she could be pregnant when her period is late and she starts feeling nauseous in the mornings. Here's an easy way to remember. Presumptive signs are subjective experiences, like missing a period and feeling sick. Question 26. A client with a head injury exhibits signs of increasing intracranial pressure, ICP. Which nursing interventions are appropriate? Select all that apply. A. Position the client with the head of the bed flat. B. Maintain the client's head in a neutral position. C. Cluster nursing activities to minimize disturbances. D. Administer stool softeners as prescribed. E. Encourage coughing and deep breathing exercises frequently. F. Monitor neurological status hourly. Answer. Maintain the client's head in a neutral position, administer stool softeners as prescribed, monitor neurological status hourly. This question tests interventions for managing increased intracranial pressure, ICP. Maintaining the head in a neutral position promotes venous drainage from the brain, reducing ICP. Administering stool softeners prevents straining during bowel movements, which can elevate ICP. Monitoring neurological status hourly is essential to detect subtle changes and trends, indicating worsening or improving ICP. The head of the bed should be elevated 30 to 45 degrees, not flat. Nursing activities should be spaced out to minimize stimulation, not clustered. Coughing and deep breathing can increase ICP, so careful suctioning and managing secretions are preferred over aggressive coughing. For example, ensuring the client's head is aligned with their body helps blood flow out of the brain. Here's an easy way to remember. Neutral head, prevent strain, and vigilant monitoring are key for managing ICP. Question 27. The nurse is caring for a client experiencing an opioid overdose. Which assessment findings should the nurse expect? Select all that apply. A. Pinpoint pupils. B. Hypertension. C. bradypnea. D. Tachycardia. E. Hypothermia. F. Hyperactive bowel sounds. Answer. Pinpoint pupils, bradypnea, hypothermia. This question assesses the nurse's ability to recognize the classic signs of an opioid overdose. Opioids are central nervous system depressants, leading to pinpoint pupils, miosis, bradypnea, slow, shallow respirations, which is the most dangerous effect, and hypothermia. Hypertension, tachycardia, and hyperactive bowel sounds are not typical. Instead, hypotension, bradycardia, and decreased bowel sounds are often seen due to overall CNS depression. For example, a person found unresponsive with very slow breathing and tiny pupils is likely suffering an opioid overdose. Here's an easy way to remember. Think slow, small, and cold for opioid overdose signs. Question 28. A client is scheduled for a barium swallow test. Which instructions should the nurse provide to the client prior to the procedure? Select all that apply. A. You will need to be NPO for 8 hours before the test. B. You may experience some diarrhea after the test. C. Drink plenty of fluids after the test to help eliminate the barium. D. Your stools may be white or light-colored for a few days. E. You will need to be positioned flat on your back during the procedure. F. Avoid taking any oral medications on the day of the test. Answer. You will need to be NPO for 8 hours before the test. Drink plenty of fluids after the test to help eliminate the barium. Your stools may be white or light-colored for a few days. This question tests the nurse's knowledge of pre- and post-procedure care for a barium swallow. Being NPO for 8 hours ensures the upper GI tract is empty for clear visualization. Drinking plenty of fluids after helps prevent constipation from the barium. White or light-colored stools are expected as barium passes through the GI tract. Diarrhea is not a typical side effect. The client will be repositioned during the test, and medication instructions depend on the specific medications, so a blanket avoidance is incorrect. For example, a client must fast overnight so the barium can coat the stomach and esophagus without interference. Here's an easy way to remember. Fast before, fluids after, and white stools are key for barium swallows. Question 29. The nurse is caring for a client post-thyroidectomy. Which assessment findings indicate a potential complication and require immediate nursing action? Select all that apply. A. Hoarseness and weak voice. B. Report of tingling around the mouth and fingertips. C. Blood pressure of 130/80 mmHg. D. Inspiratory stridor. E. Positive Chvostek's sign. F. Urine output of 60 milliliters per hour. Answer. Hoarseness and weak voice, report of tingling around the mouth and fingertips, inspiratory stridor, positive Chvostek's sign. This question assesses the nurse's ability to recognize serious complications post-thyroidectomy. Hoarseness and a weak voice can indicate laryngeal nerve damage. Tingling around the mouth and fingertips and a positive Chvostek's sign, facial twitch upon tapping the facial nerve, are classic signs of hypocalcemia, often due to accidental parathyroid gland removal. Inspiratory stridor, a high-pitched crowing sound on inhalation, is an emergency sign of airway obstruction from laryngeal edema or hematoma. A blood pressure of 130/80 mmHg is generally acceptable, and urine output of 60 milliliters per hour is normal. For example, if a client develops a high-pitched noisy breath sound, it means their airway is closing and requires immediate attention. Here's an easy way to remember. Voice changes, tingling, stridor, and Schwastex are critical warning signs after thyroid surgery. Question 30. A client with a history of alcohol use disorder is admitted with acute pancreatitis. Which interventions should the nurse include in the client's plan of care? Select all that apply. A. Administer opioid analgesics for pain management. B. Provide a high-fat diet to promote healing. C. Maintain NPO status. D. Administer intravenous fluids as prescribed. E. Monitor serum amylase and lipase levels. F. Encourage ambulation to prevent complications. Answer. Administer opioid analgesics for pain management, maintain NPO status, administer intravenous fluids as prescribed, monitor serum amylase and lipase levels. This question tests appropriate nursing care for a client with acute pancreatitis. Administering opioid analgesics is crucial for managing the severe pain. Maintaining NPO status, nothing by mouth, and administering intravenous fluids are essential to rest the pancreas and correct dehydration. Monitoring serum amylase and lipase levels helps track the severity and resolution of the inflammation. A high-fat diet would exacerbate the condition, and ambulation might not be feasible or advisable in the acute, painful phase. For example, a client with acute pancreatitis will need strong pain medication and must not eat or drink anything by mouth to allow the pancreas to rest. Here's an easy way to remember. Pain relief, NPO, fluids, and enzyme checks are vital for acute pancreatitis. Question 31. The nurse is preparing to administer a blood transfusion. Which actions are essential prior to initiating the transfusion? Select all that apply. A. Obtain baseline vital signs. B. Verify the client's identity with another licensed nurse. C. Administer acetaminophen orally as a prophylactic measure. D. Prime the 4 tubing with 0.9% sodium chloride. E. Check the expiration date of the blood product. F. Document the blood product unit number in the client's chart. Answer. Obtain baseline vital signs, verify the client's identity with another licensed nurse, prime the 4 tubing with 0.9% sodium chloride, check the expiration date of the blood product, document the blood product unit number in the client's chart. This question assesses the critical safety steps before administering a blood transfusion. Obtaining baseline vital signs is necessary for comparison if a reaction occurs. Verifying client identity with another licensed nurse is a crucial safety double-check. Priming the 4 tubing with 0.9% sodium chloride is essential as dextrose solutions would cause red blood cell hemolysis. Checking the expiration date ensures product viability, and documenting the unit number provides traceability. Prophylactic acetaminophen is not a universal standard and requires a prescription. For example, before hanging the blood, 2 nurses must confirm it's the right blood for the right patient. Here's an easy way to remember. Vitals, 2 checks, saline, expiration, and documentation are non-negotiable for blood transfusions. Question 32. A client with a history of seizures is admitted to the hospital. Which interventions should the nurse include in the client's plan of care to ensure safety during a potential seizure? Select all that apply. A. Place a tongue blade in the client's mouth at the onset of a seizure. B. Ensure oxygen and suction equipment are readily available. C. Pad the side rails of the bed. D. Restrain the client's extremities during a seizure. E. Keep the bed in the lowest position. F. Loosen tight clothing around the client's neck. Answer. Ensure oxygen and suction equipment are readily available. Pad the side rails of the bed. Keep the bed in the lowest position. Loosen tight clothing around the client's neck. This question evaluates seizure precautions and safety. Ensuring oxygen and suction equipment are available prepares for airway management. Padding the side rails and keeping the bed in the lowest position prevent injury from falls. Loosening tight clothing around the neck promotes breathing. A tongue blade should never be inserted during a seizure due to injury risk, and restraining extremities is dangerous and ineffective. For example, if a client starts having a seizure, the nurse should ensure they are safe from hitting anything hard and can breathe easily. Here's an easy way to remember. For seizure safety, think protect, oxygen, and clear airway. Never restrain or put things in the mouth. Question 33. The nurse is caring for a client with a new peripherally inserted central catheter, PIC, line. Which actions are appropriate for PICC line care? Select all that apply. A. Obtain a chest X-ray to confirm placement before initial use. B. Use 10 milliliters or larger syringes for flushing. C. Change the dressing every 24 hours. D. Flush with heparin or saline as per policy. E. Avoid taking blood pressure on the arm with the PICC line. F. Administer all 4 medications through the PICC line. Answer. Obtain a chest X-ray to confirm placement before initial use. Use 10 milliliters or larger syringes for flushing. Flush with heparin or saline as per policy. Avoid taking blood pressure on the arm with the PICC line. This question tests proper care and maintenance of a peripherally inserted central catheter, PIC, line. Obtaining a chest X-ray to confirm tip placement is mandatory before initial use to ensure it's in the correct vein and not in the heart or lungs. Using 10 milliliters or larger syringes prevents excessive pressure that could damage the catheter. Flushing with heparin or saline as per policy maintains patency. Avoiding blood pressure on the PICC arm prevents vein compression and potential damage. Dressings are typically changed every 5 to 7 days or if soiled, not every 24 hours. While many 4 medications can be administered through a PICC, a blanket all is too absolute and depends on medication compatibility and client needs. For example, before using a newly placed PICC for the first time, an X-ray must confirm its tip is in the right place. Here's an easy way to remember. Confirm, flush big, maintain, and protect the arm for PICC line care. Question 34. A client with acute glomerulonephritis is admitted to the hospital. Which nursing assessment findings should the nurse anticipate? Select all that apply. A. Hypotension. B. Periorbital edema. C. Frothy urine. D. Oliguria. E. Increased urine-specific gravity. F. Hypoalbuminemia. Answer. Periorbital edema, frothy urine, oliguria, increased urine-specific gravity, hypoalbuminemia. This question focuses on the signs and symptoms of acute glomerulonephritis, an inflammatory kidney condition. Periorbital edema, swelling around the eyes, and oliguria, decreased urine output, are common due to fluid retention. Frothy urine is indicative of proteinuria, excess protein in urine, and hypoalbuminemia, low serum albumin, results from protein loss through the damaged glomeruli. Increased urine-specific gravity reflects concentrated urine due to fluid retention and protein loss. Hypertension, not hypotension, is expected due to fluid overload and kidney dysfunction. For example, a child with swollen eyes and dark, foamy urine may be presenting with acute glomerulonephritis. Here's an easy way to remember. Swelling, dark foamy pee, and less P are common signs of glomerulonephritis. Question 35. The nurse is preparing a client for discharge following cataract surgery. Which instructions should be included in the discharge teaching? Select all that apply. A. You can rub your eye gently if it feels itchy. B. Avoid bending, stooping, or lifting heavy objects. C. Report any sudden decrease in vision or severe pain. D. You may resume driving as soon as you feel comfortable. E. Wear an eye shield at night for the first week. F. It is normal to have some slight redness and mild discomfort. Answer. Avoid bending, stooping, or lifting heavy objects. Report any sudden decrease in vision or severe pain. Wear an eye shield at night for the first week. It is normal to have some slight redness and mild discomfort. This question assesses critical postoperative teaching for cataract surgery to prevent complications. Avoiding bending, stooping, or lifting heavy objects prevents increased intraocular pressure. Reporting sudden vision decrease or severe pain is vital as these indicate serious complications. Wearing an eye shield at night protects the healing eye from accidental injury. Some slight redness and mild discomfort are normal expected findings. Rubbing the eye is contraindicated as it can cause damage, and driving should only resume after clearance from the ophthalmologist, not just when the client feels comfortable. For example, a client must understand that any activity that puts strain on the eye can jeopardize their surgical outcome. Here's an easy way to remember. No strain, watch for red flags, protect, and expect mild symptoms. Question 36. A client is experiencing a severe allergic reaction, anaphylaxis. Which actions should the nurse prioritize? Select all that apply. A. Administer epinephrine intramuscularly. B. Place the client in a supine position with legs elevated. C. Initiate rapid intravenous fluids. D. Administer an antihistamine orally. E. Prepare for intubation if airway compromise worsens. F. Administer a beta agonist nebulizer. Answer. Administer epinephrine intramuscularly, place the client in a supine position with legs elevated, initiate rapid intravenous fluids, prepare for intubation if airway compromise worsens, administer a beta agonist nebulizer. This question tests priority interventions for anaphylaxis, a life-threatening allergic reaction. Administering epinephrine intramuscularly is the first-line treatment to reverse symptoms. Placing the client in a supine position with legs elevated helps improve blood pressure and circulation. Initiating rapid intravenous fluids addresses vasodilation and capillary leakage, which lead to hypovolemic shock. Preparing for intubation is crucial if the airway becomes severely compromised. Administering a beta agonist nebulizer, like albuterol, helps with bronchospasm. Oral antihistamines are secondary and not a priority in an acute anaphylactic emergency. For example, if a client collapses and struggles to breathe after an insect sting, the nurse must immediately administer epinephrine and ensure their airway and circulation are supported. Here's an easy way to remember. EPI, supine, fluids, airway, and breathing support are the immediate actions for anaphylaxis. Question 37. The nurse is providing education to a client with a new prescription for metronidazole, Flagyl. Which instructions should the nurse include? Select all that apply. A. Take this medication on an empty stomach. B. Avoid alcohol consumption while taking this medication and for 3 days after. C. You may notice a metallic taste in your mouth. D. This medication can cause your urine to turn dark or reddish-brown. E. It is important to complete the entire course of antibiotics. If. Take antacids if you experience stomach upset. Answer. Avoid alcohol consumption while taking this medication, and for 3 days after, you may notice a metallic taste in your mouth. This medication can cause your urine to turn dark or reddish brown. It is important to complete the entire course of antibiotics. This question assesses knowledge of important teaching points for metronidazole, flagyl. Avoiding alcohol is critical due to a disulfiram-like reaction, severe nausea/vomiting, flushing. A metallic taste and dark or reddish-brown urine are common, harmless side effects. Completing the entire course of antibiotics prevents antibiotic resistance and ensures eradication of the infection. Metronidazole can be taken with food to minimize GI upset, and antacids may interfere with absorption. For example, a client must be warned that drinking alcohol with this medication can cause extreme sickness. Here's an easy way to remember. No alcohol, weird taste/urine, and finish the meds for metronidazole. Question 38. A client is diagnosed with a deep vein thrombosis, DVT, and is prescribed enoxaparin, Lovenox, subcutaneously. Which nursing actions are appropriate? Select all that apply. A. Administer the injection into the deltoid muscle. B. Pinch the skin fold during the entire injection. C. Do not rub the injection site after administration. D. Use an air bubble in the syringe for administration. E. Administer the injection 2 inches from the umbilicus. F. Apply a warm compress to the site after injection to aid absorption. Answer. Pinch the skin fold during the entire injection. Do not rub the injection site after administration. Use an air bubble in the syringe for administration. Administer the injection 2 inches from the umbilicus. This question tests proper administration technique for subcutaneous enoxaparin. Pinching the skin fold during the entire injection and not rubbing the site minimize bruising. Using an air bubble ensures the full dose is delivered and helps seal the medication. Administering 2 inches from the umbilicus, in the abdominal fatty tissue, is the preferred site. It is administered subcutaneously, not intramuscularly, deltoid, and a warm compress is not indicated and could increase absorption too quickly. For example, a client needs to understand that vigorous rubbing after the shot can cause significant bruising. Here's an easy way to remember. Pinch, no rub, air bubble, and belly fat are key for Lovenox injections. Question 39. The nurse is caring for a client with hyperthyroidism. Which clinical manifestations should the nurse expect to observe? Select all that apply. A. Weight gain. B. Bradycardia. C. Heat intolerance. D. Exophthalmos. E. Diaphoresis. F. Constipation. Answer. Heat intolerance, exophthalmos, diaphoresis. This question assesses the nurse's knowledge of the signs and symptoms of hyperthyroidism, a condition of excessive thyroid hormone. Hyperthyroidism leads to an increased metabolic rate, resulting in heat intolerance, diaphoresis, excessive sweating, and often exophthalmos, bulging eyes, in Graves' disease. Weight loss, not gain, tachycardia, not bradycardia, and diarrhea, not constipation, are also common. For instance, a client who frequently feels too warm, sweats a lot, and has prominent eyes might be experiencing hyperthyroidism. Here's an easy way to remember. Hot, sweaty, and bulging eyes are classic for hyperthyroidism. Question 40. A client is admitted with suspected peptic ulcer disease, PUD. Which assessment findings support this diagnosis? Select all that apply. A. Pain that is relieved by eating food. B. Burning sensation in the epigastric region. C. Weight gain. D. Melena. E. Hematemesis. F. Pain that worsens with food intake. Answer: pain that is relieved by eating food, burning sensation in the epigastric region, melena, hematemesis, pain that worsens with food intake. This question tests the nurse's ability to identify the varied symptoms of peptic ulcer disease, PUD, which can manifest differently depending on the ulcer's location. A burning sensation in the epigastric region is a hallmark symptom. Pain that is relieved by eating food, duodenal ulcer, or worsens with food intake, gastric ulcer, are both possible presentations. Melena, black, tarry stools, and hematemesis, vomiting blood indicate GI bleeding. Weight gain is not a typical finding. Clients often experience weight loss due to fear of pain with eating. For example, a client might report a gnawing stomach pain that feels better after eating a sandwich but then comes back later. Here's an easy way to remember. PUD can cause epigastric burning, variable pain with food, and signs of bleeding. Question 41. The nurse is providing discharge teaching to the parents of a child with cystic fibrosis. Which instructions should the nurse include? Select all that apply. A. Administer pancreatic enzymes with meals and snacks. B. Encourage a low-calorie, low-fat diet. C. Perform chest physiotherapy daily. D. Provide a high-protein, high-calorie diet. E. Monitor for signs of hyperglycemia. F. Restrict fluid intake to prevent fluid overload. Answer: administer pancreatic enzymes with meals and snacks, perform chest physiotherapy daily, provide a high-protein, high-calorie diet, monitor for signs of hyperglycemia. This question assesses knowledge of essential management strategies for cystic fibrosis, CF. Administering pancreatic enzymes with meals and snacks is crucial for nutrient absorption due to pancreatic insufficiency. Performing chest physiotherapy daily helps clear thick mucus from the lungs. A high-protein, high-calorie diet is necessary to meet increased metabolic demands and compensate for malabsorption. Monitoring for hyperglycemia is important because pancreatic damage can lead to CF-related diabetes. A low-calorie, low-fat diet is contraindicated, and fluid restriction is usually not required unless other complications exist. For example, a child with CF needs to take their enzymes every time they eat to help their body absorb the necessary nutrients to grow. Here's an easy way to remember. For CF, think enzymes with food, chest PT, high-calorie diet, and watch blood sugar. Question 42. A client is admitted with possible viral meningitis. Which assessment findings should the nurse anticipate? Select all that apply. A. Nuchal rigidity. B. Positive Brudzinski's sign. C. Petechial rash. D. Photophobia. E. Confusion. F. Elevated protein and decreased glucose in CSF. Answer: nuchal rigidity, positive Brudzinski's sign, photophobia, confusion. This question tests the nurse's ability to identify common clinical manifestations of meningitis. Nuchal rigidity, stiff neck, positive Brudzinski's sign, flexion of hips and knees when the neck is flexed, photophobia, sensitivity to light, and confusion are all characteristic symptoms of meningeal irritation, whether viral or bacterial. A petechial rash is more indicative of bacterial, meningococcal, meningitis. In viral meningitis, CSF protein may be normal or slightly elevated, and glucose levels are typically normal, unlike bacterial meningitis where glucose is decreased. For example, a client with a severe headache, sensitivity to light, and difficulty touching their chin to their chest needs evaluation for meningitis. Here's an easy way to remember. Stiff neck, light sensitivity, confusion, and specific reflexes point to meningitis. Question 43. The nurse is providing education to a client prescribed spironolactone, aldactone. Which statements indicate effective understanding of the teaching? Select all that apply. A. I should avoid eating foods high in potassium. B. I will take this medication with food. C. I should report any muscle weakness or irregular heartbeat. D. I can use salt substitutes freely. E. This medication will make me urinate more frequently. F. I will weigh myself daily and report any significant changes. Answer. I should avoid eating foods high in potassium. I will take this medication with food. I should report any muscle weakness or irregular heartbeat. I will weigh myself daily and report any significant changes. This question assesses comprehension of important teaching points for spironolactone, a potassium-sparing diuretic. Avoiding foods high in potassium is essential because spironolactone can cause hyperkalemia. Taking it with food helps increase absorption and reduce stomach upset. Reporting muscle weakness or irregular heartbeat is crucial as these are signs of hyperkalemia or fluid imbalance. Daily weights help monitor for fluid retention or excessive fluid loss. Salt substitutes often contain potassium chloride and should be avoided. While it's a diuretic, spironolactone generally causes less frequent urination compared to loop or thiazide diuretics. For example, a client should know that eating bananas, which are high in potassium, could be dangerous while taking this medicine. Here's an easy way to remember. Low potassium diet, with food, watch for potassium signs, and daily weights for spironolactone. Question 44. A client in labor has an epidural anesthesia infusing. Which nursing interventions are appropriate during this time? Select all that apply. A. Monitor maternal blood pressure every 5 to 15 minutes. B. Assess for bladder distension frequently. C. Encourage the client to remain in a supine position. D. Encourage frequent repositioning. E. Administer a bolus of intravenous fluids prior to epidural insertion. F. Assess fetal heart rate continuously. Answer. Monitor maternal blood pressure every 5 to 15 minutes, assess for bladder distension frequently, encourage frequent repositioning, administer a bolus of intravenous fluids prior to epidural insertion, assess fetal heart rate continuously. This question tests essential nursing care for a laboring client with an epidural. Monitoring maternal blood pressure frequently is crucial due to the risk of hypotension. Assessing for bladder distension is vital as epidurals can impair the urge to void. Encouraging frequent repositioning helps distribute the anesthetic and prevent pressure injuries. Administering a fluid bolus prior to insertion helps prevent hypotension. Assessing fetal heart rate continuously monitors fetal well-being in response to maternal changes. The client should not remain supine as it can cause supine hypotension and reduce fetal perfusion. For example, before an epidural, the nurse will give 4 fluids to help prevent the mother's blood pressure from dropping too low. Here's an easy way to remember. BP, bladder, position changes, fluids, and fetal heart are key for epidural care. Question 45. The nurse is caring for a client receiving chemotherapy who develops stomatitis. Which interventions should the nurse include in the plan of care? Select all that apply. A. Offer hot, Spicy foods to stimulate appetite. B. Provide soft, bland foods. C. Use a soft bristled toothbrush for oral hygiene. D. Administer viscous lidocaine as prescribed before meals. E. Encourage use of alcohol-based mouthwash. F. Inspect oral mucosa daily. Answer. Provide soft, bland foods, use a soft bristled toothbrush for oral hygiene, administer viscous lidocaine as prescribed before meals, inspect oral mucosa daily. This question assesses appropriate nursing interventions for stomatitis, inflammation of the mouth and oral tissues, a common side effect of chemotherapy. Providing soft, bland foods and administering viscous lidocaine help manage pain and discomfort during eating. Using a soft bristled toothbrush and inspecting oral mucosa daily promote oral hygiene and early detection of worsening symptoms. Hot, spicy foods and alcohol-based mouthwashes would irritate the inflamed mucosa, worsening discomfort. For example, a client with stomatitis can find it easier to eat mashed potatoes and can soothe their mouth with prescribed numbing solutions. Here's an easy way to remember. Soft food, gentle care, pain relief, and daily checks for stomatitis management. Question 46. A client is admitted with signs of severe preeclampsia. Which assessment findings should the nurse anticipate? Select all that apply. A. Proteinuria. B. Hypotension. C. Deep tendon reflexes 1+. D. Headache. E. Epigastric pain. F. Hyperreflexia. Answer. Proteinuria, headache, epigastric pain, hyperreflexia. This question tests the nurse's ability to recognize the characteristic signs and symptoms of severe preeclampsia, a pregnancy complication. Proteinuria, headache, and epigastric pain are classic indicators. Hyperreflexia, deep tendon reflexes 3+ or 4+, is also common, indicating central nervous system irritability. Hypotension is not characteristic. Instead, hypertension, blood pressure 160/110 mmHg, is a defining feature, and DTRs of 1+ would be hyporeflexia, not hyperreflexia. For instance, a pregnant client complaining of a persistent headache and severe pain in the upper right abdomen needs immediate evaluation for preeclampsia. Here's an easy way to remember. Preeclampsia involves protein in urine, high BP, headache, upper belly pain, and jumpy reflexes. Question 47. The nurse is caring for a client with a CVA, stroke, who has left-sided hemiparesis. Which nursing interventions are appropriate for promoting client safety and mobility? Select all that apply. A. Place the call light on the client's right side. B. Position food on the client's left side of the tray. C. Remind the client to scan the environment to the left. D. Provide a cane for ambulation. E. Use a gait belt when ambulating the client. F. Dress the affected side first. Answer. Place the call light on the client's right side, remind the client to scan the environment to the left, use a gait belt when ambulating the client, dress the affected side first. This question addresses safe and effective care for a stroke client with left-sided hemiparesis, weakness. Placing the call light on the strong, right, side ensures the client can reach it. Reminding the client to scan to the left addresses left-sided neglect. Using a gait belt provides safety during ambulation. Dressing the affected side first promotes independence and easier dressing. Food should be placed on the unaffected side, and a cane may not be sufficient for initial ambulation with significant hemiparesis. More support like a walker or assistant is often needed. For example, When helping a client get dressed, the nurse should guide them to put their left arm into the sleeve first. Here's an easy way to remember. Strong side for safety, skin neglected side, use a gait belt, and dress affected first. Question 48. A client is prescribed a low-sodium diet. Which food choices indicate the client understands the dietary restrictions? Select all that apply. A. Canned soup. B. Fresh fruits and vegetables. C. Deli meats. D. Baked chicken without skin. E. Pretzels. F. Plain oatmeal. Answer. Fresh fruits and vegetables, baked chicken without skin, plain oatmeal. This question evaluates a client's understanding of a low-sodium diet. Fresh fruits and vegetables, baked chicken without skin, and plain oatmeal are naturally low in sodium or have no added sodium. Canned soup, deli meats, and pretzels are typically high in sodium and should be avoided or consumed minimally. For example, instead of grabbing a can of soup, a client should opt for fresh vegetables and lean protein. Here's an easy way to remember. Fresh and unprocessed are generally low in sodium. Question 49. The nurse is assessing a client with diverticulitis. Which findings should the nurse expect? Select all that apply. A. Right lower quadrant pain. B. Nausea and vomiting. C. Fever. D. Constipation or diarrhea. E. Rebound tenderness in the left lower quadrant. F. Elevated white blood cell count. Answer. Nausea and vomiting, fever, constipation or diarrhea, rebound tenderness in the left lower quadrant, elevated white blood cell count. This question tests the nurse's knowledge of the typical clinical presentation of diverticulitis. Nausea and vomiting, fever, constipation or diarrhea, rebound tenderness in the left lower quadrant, as diverticula are common in the sigmoid colon, and an elevated white blood cell count, indicating inflammation/infection, are all characteristic. Right lower quadrant pain is more typical of appendicitis. For example, a client presenting with left-sided abdominal pain, a fever, and feeling nauseous could be experiencing diverticulitis. Here's an easy way to remember. Left lower pain, nausea, fever, changed bowels, and high WBC point to diverticulitis. Question 50. The nurse is providing care for an infant with bronchiolitis. Which interventions should the nurse include in the plan of care? Select all that apply. A. Administer antibiotics as prescribed. B. Encourage frequent oral fluid intake. C. Monitor oxygen saturation levels. D. Elevate the head of the bed. E. Administer corticosteroids to reduce inflammation. F. Suction nasal passages as needed. Answer. Monitor oxygen saturation levels, elevate the head of the bed, suction nasal passages as needed. This question assesses appropriate nursing interventions for an infant with bronchiolitis, a common viral respiratory infection. Monitoring oxygen saturation levels is critical for assessing respiratory status and hypoxemia. Elevating the head of the bed helps improve breathing. Suctioning nasal passages helps clear secretions, facilitating breathing and feeding. Bronchiolitis is typically viral, so antibiotics are ineffective, and corticosteroids are generally not recommended. Frequent oral fluid intake may be difficult for an infant with respiratory distress, so fluids might be needed. For example, an infant struggling to breathe with copious nasal secretions will benefit greatly from having their nose suctioned before feeding. Here's an easy way to remember. O2 watch, elevate, and clear the nose are key for bronchiolitis care.